Excellency Dr. Liat Adese, Minister of State for the Federal Ministry of Health of Ethiopia, the African Union Commission representative, WHO representative, Consortium for Reproductive Health Associations, representatives of the UN family, distinguished participants, ladies and gentlemen. We have had a very busy week. I think since last week talking about health in different forums. I think we started with a fora that was chaired by President Kagame and had Bill Gates talking about health and what the public sector should do. We had a forum on what African private sector can do to finance health, and now we're having a forum with you. In many of our countries, civil society and NGOs are a big part of the health financing infrastructure. And so we thought that as we have this discussion on health, it will be important to have you as part of this discussion. Also, because we need to understand what are the constraints and the impediments to ensuring that you can also help provide the support that you give to those who need health the most in a way that is efficient. Let me just give you, I think we have produced a report, but I'm looking around the table and I don't see it. I'm sure you will get copies of it soon. Africa has made a lot of progress in the health space. We have come from a place where life expectancy was about 54 to 63 years today. Maternal mortality has almost halved in many countries. In Ethiopia in particular, we have gone from 871 to 412 maternal deaths per 100,000. In the same period, under 5 mortality rates in Ethiopia have declined from 166 to 67 deaths per 1,000 live births. Second, women who are the vulnerable group often face numerous challenges in accessing health care. I think we all know that we have to wake up in the morning as women and walk a lot of distances to find good health care. There is a lot of discrimination of different sorts against women in Ethiopia, for instance. Infant mortality rate is 61 among infants with mothers with no primary education. So I think the story here is that education of mothers is particularly important for the welfare of the child, and we hope that we can do better. And we have only 40 per 1,000 live births among women with secondary or higher education. So in some sense, I think that part of the conversation around healthcare is not so much, and I think that this is where you as civil society come in. When we talk about healthcare, we talk a lot about the clinics and the primary healthcare offices, but there is a lot more that we need to do, particularly in the maternal mortality space, around clean water, around education, and all the other associated elements that help ensure that a woman's health and is first of all important, and one that she knows what to do before the child comes. And so I think that when you look at yourselves, you're not only NGOs in the health space, but also in the education space, in the water space, because we believe that a lot of this different disciplines are important for a woman's health and consequently for child care. The other part where we've made some progress on the continent is where the skills and support for particularly maternal mortality and professional health workers. I think we have done a lot to produce, and particularly our governments, to produce and develop more skilled professionals. But of course, as we develop them, many of them leave our countries and go to more fertile territory. And so we need to continue developing more. I don't think we will win the skills drain war by just saying that we are draining our skills. People will always move to where they believe that economically life is more viable for them. That does not mean that we should not continue to produce more skills. WHO, for example, says that you need about 23 medical professionals per 1,000, per 10,000 population. In Ethiopia, we have less than 5. So there's still a very huge gap in between, and I think we need to do a little bit more to improve on those numbers. Again, I think there is the big challenge between producing, more skilled workers and the fact that those skilled workers then migrate, and we're very proud of the fact that we're passing the Continental Free Trade Area Agreement and the free movement, which means that people can move around and find jobs where they believe that they will be most productive. But that means also that we need to produce more skilled workers. Finally, I think that what is the bigger concern for Ethiopia is really out-of-pocket expenditure. Average out-of-pocket expenditure on the continent for healthcare is 36% so about 36 cents per dollar. In Ethiopia, it's 38, so Ethiopia is slightly higher than the average. This means that people are willing to spend their own out-of-pocket resources for healthcare, but it also means that they may not necessarily always be getting the best healthcare that they need. And I think that what we are trying to do is to say, can we ensure that as people vote with their resources to spend resources on healthcare, we also ensure on the policy side and on the delivery side that they're getting the kind of quality healthcare they need. It also means that the government needs to spend a little bit more. We know, and I think a lot of the discussion 2 days ago in the private sector health forum was the private sector will not come in if the public sector does not ensure basic services. So in some sense, you do need some public expenditure. Ethiopia is doing more or less well compared to many other countries in terms of how much it is spending, because it is already spending 4% of GDP. I think the norm is about 5%. Most of the African average is 2 to 3%. So Ethiopia is higher than the African average. It's not at the expected 5% that we would like to see it at, but it is at 4%. But I think, again, the story there is, one, the government is doing its best, it's doing the 4%, but the population is saying, we want to spend on healthcare, we know it's important, so give us the right kind of healthcare. And I think that here you have a story where maybe we can all come together to ensure that as you work, and particularly in the rural communities, we can ensure that community-based health care is at its best. Ethiopia has made some progress. I think in 2011, the government of Ethiopia introduced 2 health insurance schemes in response to the high out-of-pocket health expenditure and low health service utilization. The community-based health insurance targets, which I'm sure the minister will tell us a little bit more about, and also the social health insurance that was designed for formal sector employees. As a result of the introduction of these health schemes, use of health insurance coverage went from 0.2% to a 4-fold increase. 1.25% is not that much, as you can see. Again, we need to spread and we need to ensure that we can reach and cover a lot more of the rural areas. But I think the story in Ethiopia is that there is effort, there is progress. Now we need to ensure that we do that last mile. There are other countries in the sub-region that are doing well and have had good experience. Rwanda, that launched a health insurance system in 1999. It does take a while, and I think that is also the story. And so we should not despair. I think in Ethiopia we started in 2011. Rwanda started in 1999, and they're just about to get to 90%. So there is, I think, a lot of effort, and this is where you match the need for more skilled health workers that can sort of take these programs and these products out into the rural areas. But I think that, again, that is where you come in. You are the ones who are almost the first respondents, if we can call you that. You are on the ground. You're much closer to the rural populations, and I think that the message that we have here is, if we can work in coordination with you to ensure that there is more information around some of these products that the government and the private sector are producing, maybe we don't need to take the 10 years that Rwanda took, but we can do it in a much faster period. I think also that the big message that came out over the weekend was the importance of partnering both the public and the private sector to ensure that some of the services that are being delivered fully on the public sector side, whether you can move them to the private sector so that the government has a little bit more fiscal space to do some of this rural expenditure. We know that healthcare on the continent will be about $259 billion industry by 2030 and could create about 16 million jobs. So again, the story here is not so much to worry about the brain drain, but to see how we can begin to create the new jobs that we believe are going to begin to federate around the health sector and ensure that the Africans, and in particular Ethiopia, since this is where we are, will have better health care. And as I said the other day, we know that the healthy society is a productive society, and a productive society will be a prosperous society. So we hope with the conversations that we have today that you tell us, and it's all of us, I think the UN family, the African Union, and the government of Ethiopia coming together to say, let us know what it is that we need to do more to ensure that as you do the work in the rural areas in particular, but also with those who are less fortunate to be able to afford first-rate health care, let us understand what kinds of policies, what kinds of products we can actually spread and help you to ensure that you can do your work better and to ensure that we have many more, in particular, healthy Ethiopian women. Thank you very much for your attention.